Good morning.
Sure. About a foot?
Am I in a good spot?
How's that?
No.
Is this all right?
You can go back one more square.
Yeah, of course.
Thank you.
It's good?
Yeah.
All right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Good morning. As we begin our briefing today, I'm joined, as usual, by County Executive Armin Budish, who joins us now on Fridays, as is our custom, and we're grateful for him being here. Followed by Dr. Heidi Gullett, our medical director. And after Dr. Gullett, you will hear from Ramona Brazil, who is our Deputy Director of Prevention and Wellness, to provide a message to the community to help on our education and our work going forward. So we'll hear first from County Executive Armin Budish.
Good morning. Good to see you all again. And as I always like to start, I want to thank Terry Allen and Dr. Heidi Gullett and the Board of Health, all the folks here at the Board of Health who are doing such life-saving work in this community, and really appreciate that. I can't say it enough. This is a terrible crisis, and what they're doing is making a huge difference. I also want to note that I'm wearing my, I'll take it off now, but I'm wearing my very, very attractive mask today. The mask was made by the Cleveland chapter of the National Council of Jewish Women. They've made and donated so far about 300 masks, cloth masks, that are being put to good use. We really appreciate what they're doing for us. We appreciate all the donations people have made. We encourage more. And I especially want to thank Marcy Schwartz for organizing the National Council of Jewish Women activity on this. Across the country, we're seeing that this crisis affects everyone, but it hits our most vulnerable residents more than others. Those without a safety net are filing in the millions for unemployment, and the homeless are struggling to keep safe. One population that's especially at risk when they're told to stay home are individuals who suffer from domestic abuse, where once they could reach out to support networks and possibly leave home when necessary, social distancing and the stay-at-home order has made that a real problem. This coronavirus is creating a worldwide surge in domestic violence. The Secretary General of the United Nations urged, in response to the domestic violence enhancement, urged all governments to put women's safety first as they respond to the pandemic. That's why I'm pleased to announce today that Cuyahoga County, along with the gracious support from the Mandel Supporting Foundation of the Jewish Federation, in conjunction with the Jack, Joseph, and Morton Mandel Foundation, it's a mouthful, but they really are doing great things, together we're supporting a creative new service delivery for the Domestic Violence and Advocacy Center to combat domestic violence in this new era of COVID-19. The Domestic Violence and Advocacy Center has been a leader in Cuyahoga County for 43 years, addressing issues of violence and abuse within families and between intimate partners. The DVCAC is a comprehensive provider of domestic violence-related services, serving nearly 20,000 women, children, and men each year. Their mission is to foster safety and healing to those affected by child abuse and domestic violence, and to prevent abuse through education, advocacy, and systemic change. Like many organizations providing such valuable and urgent services in this time of COVID-19, the DVCAC has had to adjust its approach to address social distancing and sheltering in place, which can be really difficult for victims of domestic violence. So I'm pleased to say that the county is providing $100,000 and the Mandel Foundation is providing another $100,000. And these new funds will allow DVCAC to implement the following: remote service delivery, use of technology to provide remote advocacy, therapy, and case management, diversion from shelter to safe alternatives. Housing and financial insecurity are two major barriers for people trying to leave an abusive environment. This funding will help to reduce individuals at the shelter and expedite moving people into safe, permanent housing. And this new program will also enable isolation and or quarantine of clients who are confirmed positive for COVID. More than anything else, these funds will allow DVCAC to help their clients rediscover their voice and their autonomy and be able to live freely without the constant consequence of violence. I want to thank the Mandel Foundation for their generous and proactive support with this very important cause. And with me is Melanie Graves. She's the director, is that the title?
Yeah, Melissa Graves.
What did I say?
Melissa Graves.
Yeah, what did I say?
You said Melanie.
Oh, Melissa Graves, I'm sorry. Melissa Graves, she's the director of the DVCAC, and she's here to answer any questions that people might have when we're through. One other announcement that I want to let people know: there are very meaningful ways in which people can help others who are in need during this crisis. This is one of the blessings of a situation like this. We see people coming together, which is tremendous, figuring out creative ways to help one another. To help others, you don't have to be, a Mandel Foundation. Anybody can do something. Today I'm sharing a new program launched by our Department of Children and Family Services in the county. It's called Operation Cuyahoga Cares. These are difficult times for many people, many families, especially parents with children. For a family that was already struggling before the crisis hit, COVID-19 has probably made it much harder to provide some basic needs for the children in many families. Kids who ordinarily might get breakfast and lunch at school, for example, are now home. So a struggling family is now incurring more food costs. The Division of Children and Family Services is currently involved with helping more than 5,000 children and teens in our county. More than 3,000 are under our custody, but more than 2,000 are not, and we're trying to provide supports for them so that they can remain safely with their families. Operation Cuyahoga Cares will match donors, and again, this can be small donations, any size donations are great. They'll match donors with a family being helped by the DCFS, the Children and Family Services. DCFS will give the donor some basic information about the family and what they need. The donor can purchase gift cards and send them to the agency, either by mail or electronically. Then the DCFS staff will make sure the gifts get to the family, and they'll notify the donor when they've been received. Everything is kept confidential and contact-free. For more information and to sign up to donate to Operation Cuyahoga Cares, please go to our website. It's cfs.cuyahogacounty.us. During these difficult days, I know many people are looking for ways to help, and this is one way that any one of us can help some of our hardest hit families and their children to make it through this crisis. Thank you very much.
Thank you very much, Executive Budish. I'd like to thank Armin for his stalwart support and that of his staff throughout this response. I've mentioned a few times the work in the Combined Emergency Operations Center, where we work very closely with the staff on the response and community messaging, which have been essential. The work now that he's brought forward with the foundation partners to address issues around domestic violence, and the Cuyahoga Cares program are a great example of how the community has stepped up, even in the face of some of the tragedies related to this pandemic. And there are many disruptions and tragedies. To see the community step up and have programs that fill gaps in need to really help those that often are ignored or invisible is a great demonstration that Cuyahoga County does care, and the programs are much needed and support the response we have relative to the overall infectious disease work we do, thinking about a person holistically and the needs holistically in the community. So I think it's a wonderful demonstration, and we're glad to see the health and social service partnerships going forward, and we're glad to be part of that. I also wanted to thank Armand for his support, particularly around personal protective equipment. He has committed through the county budget a lot of dollars to support personal protective equipment that is used by a whole range of partners in the community. This is critical to protect and prevent the number of cases that may occur in the community. It can prevent fatalities and really protect those on the front lines. So that's another piece we think that's essential, and we're grateful for that as well. So this week, the governor has announced that there are a number of things sort of coming forward relative to discussions around how we begin to gradually reopen as a state. And these discussions, of course, are happening across the country. So we've heard that hospitals and outpatient clinics will begin to reschedule certain medical procedures and surgeries, outpatient surgeries, following the existing guidance on personal protective equipment and other controls to reduce transmission. So this is a step forward, being done cautiously on some specific medical needs in the community. The governor has cautioned that the entire healthcare system is not ready, in his words, to be turned back on. So I think we recognize that this is going to be a phased approach. The governor said that the state is following the broad guidelines set forth by the federal government and will make an announcement regarding the reopening on Monday. There are a range of data-driven considerations that we must take into account as we work through the phased approach of reopening. The continued expansion of testing is important. As we know nationally, there's been a gap in testing needs, and we also need to be working to protect the most vulnerable people that are in congregate settings in particular, like long-term care facilities or correctional facilities, adult care homes, people with disabilities, and in shelters. So as we move forward and begin to open, we want to make sure that we're working quickly to suppress cases that may occur because of these vulnerable populations being in these settings where people are close together unavoidably. We remain committed to our work around contact tracing, quarantine and isolation to reduce the opportunity for community spread, making sure businesses, schools, and other public places can continue their physical distancing, and following the data-driven decisions as we have throughout the process. Let the data describe what the next step should be. Use data to make decisions on what's best for our community with visions facing businesses and government here in Ohio and throughout the country. And so we'd ask you first to pause and recognize that as we respond, the disruptions, the fallout, and some of the difficulties families are facing, we need to recognize that those sacrifices are very deep and can have lasting effects. And so we want to take a moment to recognize that and to do what we can to reach out to our neighbor to help more than ever now in this challenging time. We were heartened to hear that there are now more than 50,000 jobs posted on the Ohio Department of Health's website. And so we want people to go to coronavirus.ohio.gov/job search. So we think that's a fantastic news that there'll be opportunities for people to find work in these challenging times. At Wednesday's press update this past Wednesday, Dr. Acton spoke about prioritizing patients for testing. She said the goal certainly is to catch cases early to prevent the worst case scenario for patients. And so there have been tiers or priority levels that are set up by the federal government to address who should be tested, even as we begin to see testing increase in the coming weeks in the community. These are people who are symptomatic or hospitalized in the first tier, or healthcare workers, of course, that we need to be tested, who are on the front lines for response. Symptomatic people in long-term care and other congregate or group living facilities, first responders, and other critical infrastructure groups are also a priority group, along with those who are 65 or older, and those who may have underlying health conditions like asthma or heart disease or diabetes. So these are the priority areas that we've been concentrating on because that's where the risk is highest. We also know there may be people who have symptoms and some that have mild symptoms in areas where there may be higher concentrations of hospitalizations. These are all tiers or priority groups that we look at as we make decisions around limited testing. We would like to be able to test as many people as possible, but what we have to do is to use these priority areas to make decisions, the best decisions about how to test in our community. So these discussions around this prioritization, you begin to see how critical the issue of making choices around how we test is. We do know now that recent reports from the state tell us that less than 1%, around 102,000 Ohioans, have been tested. So we know that we need to do better, and testing needs to be made more widely available. It continues to be a challenge. These data speak to the reasons why we ask that you do all you can to stay healthy and to protect those who are most vulnerable and at risk. We have to save our resources that people on the front line people on the front lines, the workers that are in these healthcare facilities and in our essential services are having the opportunity to be tested, along with those that have underlying medical conditions. The masks, the physical distancing, the cleaning, all these pieces are critical to help us in our path forward. They're essential in our path forward as we begin this gradual reopening of the state. We have to remember that our case counts and fatality numbers are still increasing. We're seeing cases, we're seeing fatalities increase, and Dr. Gullett will describe those numbers. So it's not time to become complacent. It's time to recognize that we need to be thoughtful about this phased reopening. The precautions that you take today could prevent a case or a potential death tomorrow. This is why we need to move slowly in the coming weeks and months. So this approach is our best path forward in guiding toward a return to some sense of normal life that we all hope for. I would end as I transition to Dr. Gullett to mention that people on the front lines have and continue in our healthcare institutions to work to try and protect those who are most vulnerable and to respond to the healthcare needs in our community. My sister is an oncology nurse, my sister Lisa, and she's been working throughout this response to provide care to cancer patients who need that care. And so doing that in a protective way is essential for those patients, but they need that care. So that goes on despite the challenges we face on a day-by-day basis, and there are many stories like my sister's, and we're thankful for the people that have put their patients first because of their vocation. And so with that, I'd like to transition to Dr. Gullett, who's going to take us through our usual Friday data roundup.
Good morning. I did have a Cavs mask on order, so I'll be able to appropriately represent, as a lifelong Cleveland sports fans, all my favorite teams shortly. So I'd like to thank Paul and Heather. Again, thank you so much for all that you continue to do for us here. And I'd like to also thank our media partners here in the room with us, appropriately distanced, and also all of you reporting from other locations remotely. We really appreciate your continued support of our community during this crisis. I'd also like today to go a little different direction with some gratitude. We are really wanting to highlight positive things. I think a lot of our media partners have done that along the way, really highlighting the very best of who we are and coming together at a really critical time. And so I'm going to veer into thanking all those folks who continue to keep the places that we can safely exercise available to us. So I, in particular, am really grateful for the beautiful outdoor space that we have in Northeast Ohio. When people come here, not during the pandemic, but other times, they are surprised we have a national park and that we have such an interesting and full trail system. And those are the kind of places where we can safely exercise and get important health-related activity in, social distancing from each other. But I think the folks who are maintaining all of that, and this is Arbor Day here. It's celebrated differently in other parts of the world depending on climate, but here in the United States, it's the last Friday in April, which is today. And for me and for us here, it sort of represents a rebirth. This is when we plant a lot of trees normally, and that's really a chance for all of us to celebrate new life, and I think that's sort of a metaphor for where we're heading as we get through COVID. And so this week, this weekend, as you hopefully exercise safely, maybe outdoors if it doesn't snow too much in April here in Ohio, I hope that you do take a moment to celebrate the beauty of the nature that we have around us, and take a moment to thank all those people who keep those trails and other exercise spaces ready for us here in Northeast Ohio. I'd also like to take a moment to thank all of the behavioral health professionals in our community. There are thousands of you, and we really are so grateful for how you have served our community day in and day out long before the pandemic hit us, but also what you do to creatively provide behavioral health services for our community now, and what you will do in the future. I have the privilege of working with an integrated system in my clinical practice where I work alongside lots of behavioral health professionals, and I couldn't practice medicine any other way because behavioral and mental health and treatment for addiction are critical parts of health. And so in our community, we have an army of professionals who are really highly trained and dedicated to doing this. I also have a sister who's a behavioral health professional and works with children. And from learning from her, I understand that there is a real disruption in the usual behavioral health services provided in person during this time. And for a lot of children, that means the behavioral health services they receive in school. And while those professionals are working very hard to deliver services over electronic devices and over phone, we know in medicine that so much of what we do is in person. And so there's a piece of that that is a challenge. And so thank you for working hard to make sure your patients receive all that they need during this time. But we do recognize the disruption to behavioral health care just as the disruption to medical care has happened. And so thank you for all you continue to do. We are with you in this. I also want to just take a moment to remind folks that there is absolutely an importance to having behavioral health care. And during this time, we continue to find that everyone is stressed. Everyone has anxiety about a lot of unknowns, and there's no shame in that whatsoever. We are here to support our community in the best health possible, and that includes our mental and behavioral health. And you heard the director of the Ohio Department of Mental Health and Addiction Services, Lori Chris, talk 2 days ago on the governor's press conference about a new COVID care line that was set up for the state. And I would encourage you to take advantage of that. If you have any concerns at all in the behavioral health or mental health realm, please take advantage of that important service. That phone number for the Ohio COVID care line is 1-800-720-9616. And then I'd also like to remind our local community here of all of the behavioral health support services available to you. You can text the Ohio Crisis Line for HOPE, so for HOPE, to 741-741. Or you can call the 24-hour suicide prevention, mental health, crisis, and information referral line here locally, 216-623-6888. Or you could call the Cuyahoga County 24-hour warm line, and you can talk with a peer. And that line is 440-886-5950. So these numbers will be available to you on our website and linked to our resources, but I wanted to highlight them in this press conference to remind everyone of the importance of caring for your own mental and behavioral health during this incredibly stressful time. So I'm going to take a moment and allow Paul and the cameras to position over to the data screen, and then I will restart talking. Good. I've got 3 of 4 thumbs up. 4 thumbs up. Okay, we're good. All right. So today for the CCBH, or the Cuyahoga County Board of Health jurisdiction, our lab confirmed cases are 1,094. Our probable cases are 411. And as a reminder, the probable cases reported here are individuals who were a contact to a lab confirmed case and who developed symptoms but have not yet been able to be tested. So we're treating those individuals as cases based on their exposure and their symptoms. The age range of our cases is 1 week to 101 years of age, and the median age of our cases is 55 years old. And we have 54% female and 46% male in the current cases. The date of illness onset for these cases is February 29th to April 21st, indicating that we still have ongoing transmission, meaning ongoing spread of cases and the infection from person to person. Our recovered cases so far are 340. So those are individuals for whom we are able to discontinue isolation, meaning that they have made it through the COVID-19 infection, although we still have a stay-at-home order, so it does not mean that that does not apply. That still applies, but we can at least say they're out of isolation. And the number of identified contacts thus far related to our cases, and those are both lab confirmed and probable cases, are 2,942. With regard to deaths, to date we have had 67 deaths. That is 66 deaths of lab confirmed cases and 1 of a probable case. The age range for those deaths is 53 to 93, with a median age of 77 and a half. The dates of deaths span from March 20th to April 22nd, and within this group there are 43% female and 57% male. I'd like to again remind everyone that these represent people from our community that we have lost, and they also represent quite a few grieving families and thousands of other families who have been affected by the infection, in that they have the infection or their family has been affected. So please continue to stand with us in protecting their privacy and supporting them in any way that you can think of that is safe and helps them in this difficult time. Among the Cuyahoga County Board of Health data, there are 23% of our cases are hospitalized at some point during their infection. You will notice that this is not the full number of cases because we do not yet have hospitalization data for all of the cases that have been reported to us. There are several points in the process at which time we collect hospitalization data, and so sometimes we don't actually find out about a hospitalization until someone is cleared from the isolation. And that's because often when we talk to people, they're doing fine at home for the first week or two, and then they become sick enough to end up in the hospital. So as a result, we don't know that they've been hospitalized until the end of their infection. So you will continue to see these data change over the coming weeks. That same description is also related to the intensive care unit or intensive care support needed by some people in our community. Again, we often don't know about this until someone has gotten through the infection. So as of the current status, we know 1,028 cases, we know whether or not they've been in the ICU. And about 8% of them have. But the remaining cases, we still have to collect those data. Among our data, we also have about nearly 22% of our cases are healthcare workers. But I did want to point out that nearly a quarter of our cases, we don't yet have their employment data. So we're going to continue to collect that information and report to you, but I wanted to give you what we have thus far. Additionally, about 43% of the cases that we have also have a pre-existing condition. So some of those things you heard Terry talk about earlier in the press conference that make someone at higher risk for a complication or higher risk to die from this infection, about 43% of our cases have that. Yet there are still another 33% for whom we don't have a full medical history, and we're continuing to obtain that information. So again, you'll see these numbers change. But our goal here is to provide you with the most complete information possible as we move along, and this continues to change literally by the hour, and our team is tireless in ensuring that we collect full information on everyone affected by COVID in our community so we can best get us all through this as quickly as possible. With regard to our data, the breakdown for race is as follows. 0.9% of individuals who are cases identify as Asian, 31.4 as Black, 55.6 as white, 3.3 is other, and 8.8% of cases we do not have race data, and we continue to try to obtain that information. It's critically important to us to understand the racial and ethnic breakdown of cases so we can ensure everyone is receiving everything they need at the moment that they need it in our community. From an ethnicity standpoint, 76% of cases identify as non-Hispanic, 2% as Hispanic, and in 22% of cases we do not have that information. That has been a little harder for us to get than race information, but again, this is a strong focus of our team, and so even since last week, we've been able to obtain more information based on our case interviews. So these graphs will be available on our website after the press conference. I do realize they're probably hard to see on the screen, but wanted to present you with as much as I could around race. That our team worked really hard over the last 2 days to do additional analyses so that our community can understand how this is affecting everyone. So this is our total cases, and you'll see that these cases represent fewer cases than what I told you earlier because these data have to be pulled a couple days before today's press conference to have all the analyses completed. So every Tuesday and Friday, I give you data that the most available I have. So that's why there are fewer cases here, around 30 or so. For these cases, 56% of folks identify as white, 31% is black, 9% unknown, 3% other, and 2% Asian. This is exactly what I presented on the prior slide, but wanted you to also have that information in a graph format. Ethnicity is below, and again is exactly what I already presented. And then there's an age distribution graph at the bottom. And this represents the age distribution of cases in our community. And you can see it spans, as I've reported previously, from 1 week of age to 101 years of age. But you can see the general distribution of how many cases or percent of cases in each of those age brackets. For hospitalized patients, we give you sex on the left and age on the right. So you'll see that hospitalizations in our community range from the 20s years of age all the way to over 80, and that's 80s, 90s, and 100s. We have a lot of community dwelling elders in our community, which is a really important part of understanding how this affects everyone. For ICU admissions on the bottom, you can also see that 35% of those folks are female and 65% male. And you can see the highest percent of ICU admissions was in the age range of 70 to 79, although we have had admissions of people in their 30s, 40s, 50s, 60s, and older than 80. Additionally, I wanted to represent what our team has worked on with regard to race and ethnicity for hospitalizations and intensive care units admissions. And so for those that are hospitalized, 53% of the hospitalized cases that were analyzed identify as white, 36% as black, 7% is unknown, 4% is other, and Asian was again around 2%. Ethnicity for admissions, 19% of those were unknown, 79% non-Hispanic, and 3% Hispanic. With regard to ICU admissions, you'll see that there is a little bit of a difference, that 49% of those admitted to ICUs are white, 42% black, 5% other, 3% of these data are unknown with regard to race, and 1% Asian. And understand that ICU admission, those 79 people represented there are also included in the hospitalization data, because that is considered a hospitalization. But we wanted to show you those most intensely affected, needing ICU care, and what those race and ethnicity data looked like separately. And with regard to ethnicity, for intensive care unit admission, 13% are unknown, 86% non-Hispanic, and then again, there very little identified as Hispanic. I believe it's about 1%, but it's not actually on the graph because the bar is very small. Additionally, we wanted to give you some other information around healthcare workers and those with pre-existing conditions. So among our healthcare workers, we have 243 of the cases that we had to analyze that we know the hospitalization status. So the unknown is 10%. You see that pie chart there. 9% of those hospitalized of the cases were healthcare workers. And from an ICU admission standpoint, 6% of those are healthcare workers. So we wanted to help you understand how this is affecting our healthcare workforce. And healthcare is broadly defined as anyone who works in a healthcare setting. So that does not just mean a hospital. That means outpatient, nursing home, home health, hospice, and otherwise. For pre-existing conditions, we also wanted to help tell the story of what we're seeing with regard to hospitalizations and intensive care unit admissions. 75% of the cases that were hospitalized were known to have a pre-existing condition. Again, those kinds of conditions Terry talked about. And with intensive care, 86% of those admissions were known to have a pre-existing condition. And again, we have some unknown data there, and we'll continue to refine that as we're able to obtain the information. We feel very strongly about presenting information to you that is accurate. And so you may see some unknowns until we have accurate information, and we will continue to update as we can. This is just our reminder of the flatten the curve analogy or metaphor that we've all been using. Our epi curve is what we've all been knowing and living by over the past 5 to 6 weeks. And so this is what you're going to see again with regard to our local information. So here's our epi curve for CCBH for the week, for this week and prior. Again, you can see that early onset date of symptoms and testing. And in red, you see confirmed and probable cases by date of symptom onset. And then you also see recovered cases in blue, and we've been presenting those now for a few weeks. We continue to have an increase in the number of people calling us for recovery interviews or discontinuation of isolation interviews every day. And so, in fact, so many that we created a new phone line, a new workflow for that, because people are very excited to be cleared from isolation. And we actually celebrate every time we get to clear someone. And you know, we had our 100 and our 200 and our 300 case, and now we're at 340. So this is a good thing for our community, but we also have thousands of people affected, so we're going to continue to be doing these for a while. Just as a reminder as well, that the end of the curve, the last few days, you see it trail off, but that means that we don't have all the information for those days. So don't interpret that as no more cases. Again, you heard me say earlier that we have date of symptom onset as late as April 21st. So we continue to have transmission, and we'll continue to update you about what that looks like and how much transmission. But again, it's also related to testing and contact tracing of tested individuals. And so without further testing, additional testing, we're still pretty limited in identifying cases. But we hope, as Terry mentioned, testing will expand in the near future. We are gearing up for being able to deploy testing when it is available in the community, but we still don't have a clear picture of when that will happen. This is our Cuyahoga County map for the week, and as I've previously noted, it continues to get darker each week in zip codes. These data here represent the number of cases for both the city of Cleveland and the other zip codes in Cuyahoga County. Some of the city of Cleveland zip codes cross into other municipalities, so that's why you see the zip codes here. And again, the picture you can take away from this is that the infections are throughout our community, and they don't stop at the Cuyahoga County borders. Our neighboring health departments have been releasing their maps as well. And we continue to work closely with our colleagues in Cleveland and surrounding health departments to make sure that everyone has what they need during this difficult time. And again, as a reminder that the zip code simply represents where individuals live, where they've told us they live. It does not represent necessarily where they contracted the infection or where they work. Before I finish with the hospital utilization information, I want to just tell you that you saw a lot of unknown data today where we didn't have information, and you saw a far fewer cases where I was able to report what our team has obtained. And part of that is that we have had a hard time in the past week with people who have been affected by this infection wanting to talk with us. And we know there are a lot of reasons for that. We feel the stress that's palpable in our community. We feel the pain that people are experiencing, not just medically or from a behavioral health standpoint, but economically. And as I have said many times, health comes from a lot of things, including a healthy economy. And a healthy community requires people have jobs. And so we understand the link here to the intense effect this has had on our community. But I would ask that if you are called by our team, please consider talking to us. Please consider giving us the information that would help you and your family and your friends get through this. We can't do this work of case identification, contact tracing, isolation, and quarantine without your help. And those are precisely the pieces of this puzzle, the tools in our toolkit that will allow us to continue to flatten the curve and get us back to work and get our economy strong again. But we need your help with that. Furthermore, everyone who works at the Board of Health or is calling you here with us at the Board of Health has the same idea about protecting your personal information. We strongly believe in privacy, and we guard your personal information immensely. So anybody that works here has been through training around how to keep information safe, and we have tremendous safeguards in place to ensure that your information stays safe here. So we want you to know that as well. And my colleague Ramona will talk a little bit more about our process, but I wanted to give you some understanding of how your ability to talk to us and your willingness to talk to us impacts what we can tell you about our community's impact from COVID-19, and also about our ability to do our job and get us through this. So finally, I always end the Friday press conferences on my part talking about our hospital utilization. So this means how close to that dotted line, which is 100% capacity, 100% of what we can tolerate in our hospital systems as far as resources, how close are we to that? And so for this week, this is for the whole county, all health systems included. Medical surgical beds for adults, we are using 68% of the capacity we have. That's an increase from 6% last week. Pediatric, we're using 43% of the capacity that we have across the county. That's an increase of 8%. The critical care beds, so the ones that need intensive care, that doesn't necessarily mean people are on ventilators, but they need a high level of care. We're at 63%, which remarkably is completely unchanged from what I reported last week. And ventilator use is at 28% of what we have capacity for, and that's a decrease of 1%. And I just want to remind everyone again that in Cuyahoga County, we have a lot of hospitals that provide high-level care and services that are specialized that may not be available in every community. So often people are transferred here for care when the hospital closer to where they live either doesn't have any more beds or they need a higher level of care. And I practiced for years in a rural community, so I can attest to being a doctor who made sure that everyone had the level of care they needed. And when I recognized somebody needed a higher level of care than the resources we had, we promptly transferred them to a facility with more resources and a higher level of service. So that's often what we see here in Cuyahoga County. So these numbers don't just represent people who are living in our county, but rather people in the northern Ohio region that have sought care or been transferred in for care. And that's an important consideration when we look at the overall picture of opening up our state. So with that, I will step away and don my mask again and allow Ramona the space, and then we'll answer questions at the end.
Good morning. We've talked a lot about the restrictions being balanced with increased testing capacity, as well as continued social distancing and the importance of contact tracing. So I want to take a few moments just to talk a little bit more about contact tracing in detail. So people will know what we're doing, a lot of the legwork that goes behind it, and if we call, what we're calling about. So it all starts with when we're notified of a positive case. And so at this point, we can find out through a variety of sources. It could be someone calls us, we receive an email through a secure email, or we find out from a lab result in the Ohio Disease Reporting System. We then attempt to contact that person and understand when did they start to feel sick. What kind of symptoms are they having? Do they have underlying conditions? And then this is also when we're trying to gather that missing demographic information that Dr. Gullett talked about. We're going to confirm race, we're going to confirm ethnicity. We will ask them about the places they have been and who they have been around from about 2 days before they started to feel sick. So this has changed a little bit over the course of this response. But now we are talking to people about who they were around before they started feeling sick. We ask them for their contact names of people they've been around and numbers. So this is how we find out about who their contacts are. We then call those contacts and we try and find out, are they having symptoms that are consistent with COVID-19? If we determine that that contact is not having symptoms, then we will place that person in quarantine. So quarantine is for people who are well, and they will be in quarantine for 14 days from the last time they had contact with the positive person. If when we call someone, they are having symptoms consistent with COVID-19, as Dr. Gullett pointed out about our probable cases, we will consider them to be a probable case, and we will place those folks in isolation. So isolation is for people who are ill, and it doesn't have a predetermined time like quarantine does. So isolation is discontinued after they meet that recovery criteria that we follow from the Centers for Disease Control and Prevention. I think it's amazing when I stop and look back on it to think about in the last 6 weeks, less than 6 weeks, that we've reached out to almost 3,000 people in our area through contact tracing. And through that, we've identified contacts who needed to be quarantined, 2,400 people. And all of that is made possible through contact tracing. And in the midst of that contact tracing, we've identified almost 400 people who were having symptoms consistent with COVID, and we're able to place those people in isolation. That's really important because that means that along with the stay-at-home order, as well as with us identifying people who may not have had the opportunity to be tested, that we're stopping the spread of that in the community from that person because they've limited their movements and we've identified that they probably have a case of COVID. So that's part of why that work is so important. So I also wanted to just stress, as Dr. Gullett discussed, that we understand when we call that people are scared. And in some cases, people are angry. They're confused on how we got their number. But we also want people to understand that when we do call, we're calling to try and understand their risks as well as their family's risks and their loved ones. Because we've seen enough circumstances where it has been spread among family members and among friend groups. And so we want to help track that down and understand who may be at risk for developing it, especially those with underlying conditions who may have further complications. So if someone calls you, we are asking that you cooperate with that contact tracing. We know that there have been scams related to contact tracing, and if people have concerns about that, they can call our main number, which is 216-201-2000, to confirm that the person that's calling is calling from the health department. Next, I would just like to talk a little bit about caring for our caregivers. These last couple of weeks have been very difficult in seeing the human toll of this virus in our community and seeing increasing numbers of death. And that is something as caregivers you carry with you. No one wants to see those who are most vulnerable being at risk and dying from this virus. It's what we're trying to prevent so hard. And we focus a lot on our long-term care facilities, and I would just like to acknowledge the work of our caregivers in those facilities. in skilled nursing facilities, the doctors, the nurse practitioners, the nurses, as well as the aides, and a variety of aides, including dietary, nursing aides, and cleaning staff, to name a few. The work is never easy. I have a lot of family members and friends who work in skilled nursing facilities or long-term care. It's not easy on a regular basis. And these folks are leaving their families and putting themselves at risk, and we need to acknowledge that. And they're trying to protect our most vulnerable. In many ways, they serve as surrogate families, and they've approached this with commitment and compassion. And we need to remember that we need to support them. I saw some social media posts the other day of a community that had decorated outside of a nursing facility and just encouraging the workers who are going there. And they need our gratitude and our empathy and our compassion. So last, I would just like to point out some signs of hope. One of the things, I try and stay off social media as much as possible. It can be a little difficult, I guess, especially at this time. But one of the concerns that I see a lot are about us not really talking about those who recover. And thankfully, most people who will get COVID-19 are going to recover. And that is a lot of hope, and that brings a lot of joy. And so, like Dr. Gullett said, we do celebrate the total number of people that we are able to clear. And today in our jurisdiction, having more than 300 is something that we are very happy about. And we're kind of waiting for the person who will clear the 400th person. We kind of mark those hundreds. And I can just note for the first time this week, in the more than 40 days since this started, we had a day where we cleared more people than we received new cases. And to me, that is a sign of hope that we will have more days like that. And we know that it will come in ebbs and flows, but it does give us hope that we're on the right path. So finally, I just would like to say something about some of the videos that I see of patients who have had COVID-19 leaving the hospital. And, as public health workers, we often don't see kind of the end result of what we're trying to achieve. And so when I see these videos, number one, I always cry because I'm a crier. But, I see the healthcare workers cheering. I see them have on masks and the right protective equipment. And I see the patient who's recovered well enough to go home. And I also see that the hospital was not overwhelmed. The hospital was able to provide the highest level of care that that person needed. And at the end, I see a patient being reunited with their family. And that gives us hope.
I'd like first to thank Ramona, who has served as part of our incident command structure. She has served in the incident command role. And I think what you saw from Ramona there is the very professional and empathetic and caring souls of our public health nurses. And Ramona is emblematic of that. Thank you, Ramona. And I think that you should know that there are public health nurses across Ohio and local health departments, state health department, who are working every day with that very caring soul and approach to this response, and we're very grateful for all that they give every day. I wanted to, as we wrap up and go to questions, thank Dr. Pauline Tarabu, Richard Stacklin, and Samantha Smith for their tireless efforts in developing the data that Dr. Gullett presents. They're up to the wee hours working to do that each week. We're now working at the health department to continue the ongoing response to COVID pandemic, even as we look at how we continue operations of other parts of the work that we do in the community, inspecting restaurants to make sure that they're safe for folks to eat at as they come in for pickup or for delivery. We're working on HIV support services in the community now to assure that those that need help receive it. Our public health nurses are providing care to children that have medical disabilities in the community, and we're working on our overdose prevention efforts around addressing opioid overdoses with our partners, even as our COVID response goes forward, and there are many other examples. So we must do both. And our commitment in public health is to do that. We want you to know that we see public health as a utility, like water and like electricity. When you turn your faucet on, when you flip your switch, people expect that to work. And the public health system has an obligation to be there to support people in many ways throughout their lifespan. And that's what we do. And that is I think, a commitment that each health department makes in Ohio and around America, to be there to assure that people have every opportunity to grow up and be healthy. So with that, I'd like to open us up for any questions that you may have.
This is for the county executive. So, from what I understand, the Jack Joseph and Morton Mandel Foundation and the county's given $200,000 for domestic abuse. I think you explained that well. Is the Operation Cuyahoga Cares, is that basically just an opportunity to fundraise? And if so, where does that money go?
The Operation CARES is through our Department of Children and Family Services, and it's an opportunity for anybody in the community to donate a small amount, if that's what they choose to do, to help a family get through this period. That's basically what it is. We'll buy gift cards for the family based on what they need and what the donor would like to do, and transmit those to the family.
Do you have goals for that, or is there a number that you?
No, it's, we have a very generous community. I mean, we've asked for other things to be donated, the PPE, we've gotten huge donations, huge numbers. This is a tough time for people, so whatever they can do, we appreciate. Anybody else? I will turn it over to Jane.
Have a nice weekend. We'll be back on Tuesday. And be safe as we talk about this transition. And remember, decisions you make today could save a life tomorrow around how you approach this transition.
I do have one more question for Dr. Cullen, if that's okay. There was one more death from the reporting period on Tuesday to what you reported today, is that correct? And if so, is that, I think like you said last time, there's a lag sometimes in reporting, or, that seems like that's very minimal. And I know there was a slight jump between Friday and Tuesday, last Friday and Tuesday. So basically, is that something to be optimistic about, or are these just kind of statistical lags or aberrations?
So the question is, it seems as if there's only one death between Tuesday and this morning as compared with the prior week when we had more increase in deaths. We have had additional deaths reported from when I arrived this morning. So there are some additional deaths. We did have a period of 3 days the week prior where we had 19 deaths in 3 days. So, I think it's important to recognize that we continue to have individuals lose their lives from this infection in our community, and I would hope that it trails to zero starting today. But the reality is we have thousands of people infected with this infection, and some of them remain very sick in the hospital. That's why it's critically important to do your part to not spread additional infection, because the more infection we have going on, the more individuals we may see very sick, particularly those with these comorbid conditions or pre-existing conditions. So it's good news for us this week, but I'm not able to say that that's a definitive trend going forward. She had one more question.
I just wanted clarification on what Ramona said about you had more recoveries in one day than you had confirmed cases. So can you specify which day that was?
Yeah, do you want to answer, or do you want me to? I want to give Ramona a chance. I'll repeat the question. So the question is, can we specify which day it was that we had more recoveries than we had new cases? We celebrate these days, so I'll let Ramona give you some more details.
So that very first day, that very first day was Tuesday. I can't say we've had another day like that, And it wasn't by many, so, but it definitely was the first time, was this past Tuesday.
Can you specifically say how many cases either way? Or-
I think I would want to confirm that number. Just to make sure.
Thank you all. Thank you very much.
Start to get off.